George's Emancipatory Theory of Compassion in Nursing. Dr. Jane George's emancipatory theory of compassion is centered around the idea that compassion is an essential element of contemporary nursing. What happens to nursing when compassion, understood as a sympathetic consciousness of others' distress and a desire to alleviate it, disappears or is rendered impossible by social process? According to the theory, nurses can either decrease suffering or contribute to suffering through their actions and practice. In class, nursing students inquired about the 4 ways of knowing through the interpersonal, intrapersonal, and contextual lenses. Each way of knowing contributes to either the biotoxic space, such as socio-political and empirical ways of knowing, or the biocompassionate space, such as ethical and aesthetic ways of knowing. In order to gain an understanding of how consent can be obtained from the parents in the case study, nursing students must take into account larger contextual factors, for example, power dynamics, and how power dynamics played a role when the family was told to go home on the Friday evening from the ER after not receiving labs or other diagnostic care for their child. Biopower, which is known as power over life and is common in places where power is exerted above life, such as in the hospital. Factors such as the ones described lead to suffering of the patient and or the nurse. Acknowledging these factors, as well as others such as health disparities and gaps in care, allows nursing students to promote and practice compassionate care and ultimately achieve emancipatory